Shrapnel was the cause of many facial injuries in World War I. The twisted metal shards produced from a shrapnel blast could easily rip a man's face off, unlike the straight-line wounds inflicted by bullets.
World War I brought a new level of violence to the battlefield. Soldiers were left with life-altering injuries from explosive shells, gunfire, and the harshness of mechanized warfare. The injuries went beyond what anyone could imagine, forcing doctors to try radical new surgeries just to give them a sense of normalcy again. However, the large number of individuals with these injuries propelled the advancement of plastic surgery aimed at restoring both appearance and functionality for those impacted. Let's look back at what these veterans went through in the tragic history of World War I plastic surgery. A new kind of war. A new kind of wound. When World War I began in 1914, few could have predicted the scale of destruction and horror it would bring. This was a brutal clash of empires, fought with deadly new weapons and tactics that changed the very nature of combat. This marked the beginning of dirty warfare, where soldiers were confined in damp, rat-infested ditches for months. The threat of machine gun fire, artillery blasts, and poison gas attacks was constant. But with this new kind of warfare came a new kind of wound, injuries that previous wars had never seen on such a massive scale. Survival came with a heavy cost for the men on the front lines. Many of them returned home with scars that would mark them for life, both physically and emotionally. But it was the damage to their faces.
This was particularly the case with regard to the faces of soldiers and sailors that had been damaged by bullets or shrapnel.
To their very identities that left the deepest wounds. The human face bore the impact of this technological terror. Soldiers watching over ditch fences exposed their heads to sniper fire and shrapnel. Those who survived often returned with injuries.
World War I changed warfare. Before it, most injuries were actually due to disease rather than actual military fighting.
That defied description, with their jaws shattered by high-velocity bullets, faces melted by chemical warfare agents, noses and ears torn away by explosion blast forces, and burns that transformed familiar features into unrecognizable masks of trauma. These broken faces presented medical challenges never before encountered in the history of warfare. Traditional medical knowledge proved woefully inadequate against such injuries. The war's signature wounds demanded innovative solutions, birthing a new medical discipline from the place of conflict. In France, plastic surgery emerged as more than just a cosmetic pursuit, as it became a vital necessity. Military hospitals were filled with young men whose faces had been transformed into masks of war. Their injuries exceeded physical trauma. These soldiers faced a life of social isolation, unable to return to their families and communities without enduring horrified stares and whispered conversations. British military surgeon Harold Gillies recognized this crisis. Working from a specialized hospital in Sidcup, England, he pioneered revolutionary techniques in facial reconstruction. His methods would lay the foundation for modern plastic surgery, transforming a fundamental practice into a refined medical specialty. As the war raged on, the need for new surgical solutions to restore faces and lives became undeniable. The history of plastic surgery and prosthetics. Plastic surgery and prosthetics have a long history, with their origins rooted in ancient civilizations. These fields of medicine have evolved, driven by necessity and the desire to restore form and function to individuals who have suffered injuries or deformities. The practice of reconstructing human features can be traced back to ancient times, when skilled surgeons found innovative solutions to address specific needs. Around 800 BC, Indian surgeons developed a groundbreaking technique for nasal reconstruction as a response to the prevalent punishment of cutting off criminals' noses. This method, known as the Indian method, involved using a flap of skin from the forehead to reconstruct the nose. Ancient Egyptians were pioneers in the field of prosthetics, creating artificial toes made from wood and leather. Meanwhile, Roman physicians experimented with facial reconstruction using skin grafts, although these early attempts were limited in their effectiveness. The 16th century witnessed significant progress in plastic surgery when Gaspare Tagliacozzi, an Italian surgeon, introduced the Italian method. This technique involved using skin from the arm to reconstruct damaged noses, a procedure that required patients to remain in an uncomfortable position for weeks while the skin graft took hold. World War I brought about a dramatic shift in both plastic surgery and prosthetics.
100 years ago, though, it was in its infancy. And indeed, it was the First World War that saw the rapid development of modern plastic surgery.
Due to the unprecedented number of facial injuries sustained by soldiers. This crisis prompted rapid innovation and the development of new techniques to address specific challenges. This led to innovations like dental splints, prosthetic eyes, facial masks, and artificial limbs. While dental splints are custom-made devices designed to stabilize shattered jaws, prosthetic eyes are glass eye technology for realistic replacements. Facial masks are copper masks painted to match an individual's skin tone, and artificial limbs are lightweight prosthetics created for improved mobility. The Queen's Hospital in Sidcup became a hub of creativity where surgeons worked tirelessly to develop methods for bone grafting, skin transplantation, facial reconstruction, and integration of prosthetics. Harold Gillies, along with his colleagues, played a pivotal role during this period by revolutionizing existing practices and introducing advanced methods. We will get into details later on. These wartime innovations elevated basic procedures into advanced surgical techniques. The urgent need to restore both function and appearance fostered unprecedented collaboration among surgeons, dentists, and artists. This alliance laid the groundwork for modern plastic surgery and prosthetic development. Medicine in the early 20th century. Picture a hospital room in 1910. The air is thick with the smell of ether, surgical tools laid out on simple metal trays, and doctors operating without the safety nets we take for granted today. Early 20th century plastic surgery bore little resemblance to the sophisticated medical field we know now. Before World War I, plastic surgery existed primarily as a cosmetic luxury for the wealthy. Surgeons performed basic procedures like rhinoplasties, which is commonly known as nose job, and scar revisions. Logically, yet these operations carried huge risks. Without reliable anesthesia, patients endured excruciating pain during procedures, often requiring physical restraints to keep them still. The absence of antibiotics meant that even minor surgical procedures could prove fatal. Infections ran rampant through hospital wards, and surgeons operated without the protective gear we consider essential today. They relied heavily on antiseptic solutions like carbolic acid, which often caused chemical burns while offering limited protection against bacteria. Surgical techniques remained basic and experimental. Doctors had little understanding of tissue healing and blood supply principles. Skin grafts frequently fail due to poor technique and post-operative care. The concept of matching blood types for transfusions was still in its infancy, making blood loss during surgery particularly dangerous. The few surgeons who specialized in facial reconstruction worked largely in isolation, developing techniques through trial and error. Medical documentation was done sparingly.
Reconstructive surgery. People rebuild, augment, or reduce parts of their bodies by the millions,
with surgeons rarely sharing their findings or methods with colleagues. This lack of collaboration slowed progress in the field significantly. Pain management posed another critical challenge. While chloroform and ether provided some relief, their administration remained dangerous and imprecise. Patients often suffered through procedures partially conscious, with their screams echoing through hospital corridors. The surgical environment itself created additional hazards. Operating rooms lacked proper ventilation and lighting, Surgeons worked without masks or gloves, their bare hands moving from patient to patient. The concept of sterile technique existed, but remained poorly understood and inconsistently applied.
Reconstructive surgery. People rebuild, augment, or reduce parts of their bodies by the millions.
When World War I began, these inadequacies became a major limitation. The increase in facial injuries overwhelmed existing medical facilities and exposed the gaps in surgical capability. Traditional methods proved insufficient for addressing complex trauma cases. The desperate need for innovation would soon transform this basic field into something entirely new. With the use of sophisticated weapons in the battlefield came injuries that were difficult to handle. Some of the injuries left the soldiers with shattered lower and upper jaw bones. Others suffered destroyed nasal structures, and severe burns left many with disfigured faces. The psychological impact of these injuries proved to be devastating for many soldiers. Numerous individuals were unwilling to go back home due to their fear of how their families would react upon seeing them. The term broken faces emerged during this time to describe these wounded men. Unable to eat normally, speak clearly, or engage in basic social interactions, many retreated into isolation. Depression and suicide became common among survivors of facial injuries. For some soldiers, their injuries had far-reaching consequences that impacted every aspect of their lives, from the breakdown of marriages and relationships to loss of social connections and community ties. The extent of these wounds propelled the medical community to develop a new approach to handling such complex cases. This marked a turning point in history. It was here that plastic surgery began its journey toward becoming an established field within medicine, one capable of restoring appearance and also reclaiming identities lost amidst chaos. Sir Harold Gillies, the pioneer surgeon. During World War I, when soldiers suffered from terrible facial injuries,
were willing to sign up for this because at the time, they were involved in a 7 or 8 year border war.
A brilliant surgeon emerged who would change the field of reconstructive surgery forever. This surgeon was Harold Gillies, who was born in New Zealand in 1882. While serving in France, he witnessed the devastating facial wounds of soldiers firsthand. These encounters deeply affected him and sparked a strong commitment to finding new surgical techniques that could restore both appearance and function to injured faces. Gillies's unwavering determination led him to establish the Queen's Hospital in Sidcup, Zrenia, England. This became the first hospital in the world solely focused on facial reconstruction. Opening its doors in 1917, this specialized facility became a refuge for over 5,000 soldiers suffering from severe facial injuries. Understanding the physical and psychological impact of such trauma, Gillies designed the hospital with serene gardens where patients could recuperate without fear of being judged by others. Within the walls of the Queen's Hospital, Gillies introduced surgical techniques that would reshape the field of reconstructive surgery.
It's particularly widely used in the medical corps.
One of his most significant contributions was the tube pedicle graft, an innovative method that ensured blood supply to transferred skin tissue. By creating a tubular bridge of skin connecting the donor site to the injured area, this technique allowed for proper survival and healing of the transplanted tissue. Under Gillies's guidance, the Queen's Hospital became a hub for surgical innovation. He meticulously documented each case using photographs and drawings, creating an invaluable archive of surgical procedures. Additionally, he established the principle of returning like with like, utilizing similar tissues for reconstruction, which continues to be a fundamental concept in modern plastic surgery. He trained numerous surgeons who would go on to spread his techniques globally, establishing new centers for facial reconstruction. Through his dedication to documentation and teaching, he ensured that his methods would benefit future generations of surgeons and patients alike. Gillies's surgical methods were not limited to simple repairs. He developed intricate procedures for reconstructing noses, ears, and jaws, often requiring multiple operations over several months. His pioneering work laid the groundwork for contemporary facial reconstruction techniques such as bone grafts and maintaining facial symmetry. Sir Harold Gillies' visionary contributions during World War I continue to shape the field of reconstructive surgery today. His unwavering commitment to restoring dignity and functionality to those affected by facial injuries became an enduring inspiration for surgeons around the world. Gillies made a breakthrough with the tube pedicle, but there were more. Surgical techniques that changed lives. Surgeons developed new techniques that would change the future of reconstructive surgery. One of the most important methods they created was called the tube pedicle technique, as stated earlier by Gillies. This technique completely changed how doctors did facial reconstruction. The tube pedicle technique involved carefully rolling a strip of healthy skin into a tube, keeping its blood supply intact. This living bridge of tissue could then be walked across the body in stages, bringing fresh, healthy skin to severely damaged areas of the face. The good thing about this method was its ability to maintain blood flow to the transferred tissue, dramatically reducing the risk of rejection that had plagued previous attempts at reconstruction. In addition to the tube pedicle, surgeons also improved various skin grafting techniques like the Thiersch grafts, full-thickness grafts, and split-thickness grafts. Thiersch grafts are ultra-thin layers of skin, carefully harvested from healthy areas of the body, while full-thickness grafts are complete sections of skin used for smaller, more detailed repairs. On the other hand, split-thickness grafts are partial-thickness skin sections ideal for covering larger areas. The success rates of these procedures were miraculous, considering the primitive conditions. Without modern antibiotics or sterilization techniques, surgeons relied on meticulous attention to detail and innovative wound care methods. They developed specialized dressing techniques and positioning strategies to protect their delicate work from infection. Private William Spreckley's case exemplified these techniques' transformative power. After losing most of his left cheek to shrapnel, surgeons used a combination of tube pedicle flaps and skin grafts to reconstruct his face over 6 separate operations. His before and after photographs became teaching tools for future generations of plastic surgeons. While Sir Harold Gillies pioneered revolutionary techniques in Britain, across the Atlantic, an Armenian-American dental surgeon named Varaztad Kazanjian was making his remarkable contributions to facial reconstruction. Known as the Miracle Man of the Western Front, Kazanjian transformed battlefield medicine through his innovative approach to jaw reconstruction. At his maxillofacial clinic in France, Kazanjian developed methods for treating mandibular fractures. His signature technique involved using external fixation devices, custom-made splints, and braces that held bone fragments in place while they healed. This approach proved particularly effective for soldiers with severe jaw injuries, allowing them to maintain proper dental alignment.
What you really have is the stronger narcissist will win out in the end.
During recovery, Kazanjian's methods differed from Gillies in their mechanical precision. Where Gillies focused on soft tissue reconstruction through tube pedicles, Kazanjian specialized in rebuilding the underlying bone structure. His background in dentistry gave him unique insights into facial anatomy and bite mechanics. Kazanjian's meticulous documentation created a valuable resource for medical professionals seeking to understand and implement his pioneering methods. By 1919, Kazanjian had treated over 3,000 soldiers at his clinic. His work earned him the title of Honorary Dental Surgeon to His Majesty King George V. Beyond individual procedures, his systematic approach to maxillofacial reconstruction helped establish protocols that would influence surgical planning for decades to come. Yet the story didn't end with skin grafts. Deeper changes were underway in maxillofacial reconstruction. The tin mask movement. When surgery fell short, art took over, crafting new faces for those who had lost theirs. During World War I, many soldiers suffered severe facial injuries that could not be fully repaired through surgery. In response to this crisis, an artistic movement emerged, offering hope and healing to these disfigured veterans. When traditional methods of surgical reconstruction fell short, talented sculptors stepped in with a groundbreaking idea of creating personalized masks for injured soldiers. These masks were crafted from thin sheets of copper and intricately painted to resemble the wearer's pre-war face. But how did these masks work? The masks were designed to be worn securely with the help of glasses or ribbon ties. They represented a unique blend of art and medicine, showcasing the skill and creativity of the artists involved. Creating these custom-made masks was no easy task. It required immense talent, patience, and attention to detail on the part of the artists. The steps involved in making each mask had artists taking plaster casts of the soldier's face and studying pre-war photographs to recreate lost features. The artists also used copper, galvanized to 1/32-inch thickness, and hand-painted each mask to match individual skin tones. They even added real hair for eyebrows and eyelashes. Two visionary artists played a crucial role in this movement: Frances Derwent Wood from Britain and Anna Coleman Ladd from America. Wood established the masks for facial disfigurement department at the 3rd London General Hospital. Ladd founded the Studio for Portrait Masks in Paris. These studios became safe havens where art breathed life back into broken faces, allowing soldiers to regain some semblance of their former selves. While these masks were undeniably works of art, they came with their own set of challenges. Unlike living skin, these masks could not express emotions or move with facial muscles. Also, summer heat made wearing them uncomfortable, while winter cold turned the metal bitter against the skin. However, over time, the paint would fade or chip away, necessitating regular upkeep to maintain a lifelike appearance. Despite their limitations, these masks offered many soldiers a chance at reintegration into society, offering them a step towards reclaiming identity in a world that struggled to embrace physical differences. The psychological effects of wearing these masks were complex and varied among individuals. While some veterans found solace in being able to go out without attracting unwanted attention, others felt imprisoned behind their metallic disguises, an observer rather than a participant in life around them. Life after surgery. After the war, wounded veterans faced a new battle of trying to fit into civilian life. These courageous soldiers had given everything for their country, but now they had to deal with the challenge of being accepted by society. The painful irony of their situation became clear as many families, caught off guard by the shocking reality of their loved ones' changed appearances, fell into stunned silence. Wives found it hard to recognize their husbands, children avoided their fathers, and parents cried at the sight of their sons' altered faces. Some soldiers even reported that their own mothers turned away from them at train stations, unable to acknowledge their returning children. Employers regularly rejected job applications from veterans with facial disfigurements. Public places became uncomfortable for these veterans, with people openly staring or avoiding eye contact. Also, many restaurants and shops refused to serve severely disfigured veterans, and social events became sources of intense mental distress for these individuals.
This was particularly the case with regard to the faces of soldiers and sailors that had been damaged by bullets or shrapnel.
The psychological effects ran deep, creating invisible wounds that often proved more devastating than physical scars. Many veterans withdrew into self-imposed isolation, only going out at night to escape public scrutiny. Depression became a constant companion, with numerous cases of substance abuse and suicide attempts documented in medical records. Despite facing immense obstacles, Some veterans found strength in their shared experiences. They formed support groups and advocacy organizations, creating safe spaces where they could openly discuss their struggles. The Guinea Pig Club, logically established later during World War II, drew inspiration from the resilience of these World War I veterans. Several survivors used their experiences as fuel for meaningful work. William Spreckley, despite having severe facial injuries, became a talented sculptor known for his memorial pieces honoring fallen comrades. Henry Lumley took it upon himself to establish a veterans support network that offered job training and placement services specifically tailored for wounded soldiers. These men's journeys sparked significant changes in how medical rehabilitation approached healing processes. Doctors began recognizing the importance of including psychological support alongside physical reconstruction efforts in treatment plans. Personal stories of soldiers who underwent facial reconstruction. Beneath the medical progress and surgical methods lies a list of human experiences, stories of bravery, perseverance, and transformation. These soldiers became pioneers in the field of reconstructive surgery, their experiences permanently altering the course of medical history. They became willing tools in the hands of surgeons who had not fully tested their newfound skills. Well, one could say they weren't left with other options. Leading seaman Walter Yeo's story stands as a stepping stone to surgical innovation. In 1916, after suffering severe facial burns during the Battle of Jutland, Yeo became one of the first patients to receive a skin graft using Dr. Gillies' revolutionary tube pedicle technique. The procedure reconstructed his eyelids, which had been destroyed in battle. His before and after photographs, still preserved today, showcase the remarkable transformation achieved through this groundbreaking surgery. Another remarkable account is that of Private William Vicarage. Although previously mentioned, he arrived at Queen's Hospital with devastating facial injuries from a blast at the Battle of Jutland. His case proved particularly challenging due to extensive tissue damage and burns. Through multiple surgeries spanning several years, Gillies reconstructed Vicarage's face using innovative skin grafting techniques. The documented progression of his surgeries became instrumental in teaching future generations of plastic surgeons. Private Thomas's case illustrates the lengthy nature of facial reconstruction during World War I. Admitted in 1918 with severe maxillofacial injuries, he underwent numerous operations until 1924. His patience and determination through years of surgical procedures helped surgeons refine their techniques for jaw reconstruction. Also, Lieutenant William Spreckley's case represented a significant achievement in nasal reconstruction. Using cartilage grafted from his rib, surgeons crafted him a new nose. This procedure becomes standard practice in reconstructive surgery. His successful operation paved the way for countless similar procedures. Private Harold Page's journey began in July 1917. His facial reconstruction required multiple staged operations, each building upon the success of the previous one. Page's detailed medical records provided valuable insights into the healing process and tissue regeneration, contributing significantly to surgical knowledge. These men's stories transcend mere medical case studies. Their willingness to undergo experimental procedures, endure multiple surgeries, and face uncertain outcomes helped establish the foundations of modern plastic surgery. Plastic surgery, then versus now. Plastic surgery is everywhere today. Most of us think of it as a way to enhance our looks. It is now an on-demand service, as anyone can walk into the facility and get the procedure done. But back then, plastic surgery wasn't even considered a legitimate field. Surgeons like Harold Gillies, who is now known as the father of modern plastic surgery, had to invent methods as they went, using whatever tools and techniques they could think of. They were pioneers, performing surgeries no one had attempted before. Anesthesia was limited, Antibiotics were almost non-existent, and even something as simple as sterilizing tools wasn't a given. Every surgery was a gamble.
What they document is that a soldier, literally with his face blown off, could years later have a normal-looking face.
Fast forward to today, and the field of plastic surgery is almost unrecognizable. We now have state-of-the-art technology that allows doctors to reshape, reconstruct, and restore with incredible precision. Modern surgeries use advanced imaging, lasers, and robotics, and nearly everything is done under clean, controlled conditions. Skin grafts, once a desperate attempt to save a soldier's face, have evolved into sophisticated procedures using microvascular techniques to reconnect tiny blood vessels, making transplants more successful than ever. Today, patients have options. Many of them come in voluntarily, seeking not just healing, but confidence and comfort in their own skin. In World War I, there were no choices. These men needed surgery just to feel human again, to be able to walk down the street without hiding their faces. The field has come a long way, but the roots of modern plastic surgery remain tied to the soldiers who faced unthinkable injuries in the trenches of World War I. These men, who went through unimaginable suffering, became unexpected heroes in the progress of modern medicine. Their sacrifice goes beyond the battlefield, impacting every surgical room today where reconstructive procedures are performed. Many surgical procedures that are now considered routine can be traced back to the makeshift operating rooms of World War I field hospitals. Sir Harold Gillies developed the tube pedicle technique, which is still a fundamental principle in plastic surgery today. Surgeons today continue to use modified versions of these methods for complex facial reconstructions. Medical schools worldwide now study these cases, learning from both the successes and failures of World War I surgeons. The detailed documentation of procedures, including photographs and surgical notes, continues to educate new generations of medical professionals. Thanks for watching. See you in the next one.